This breakout session is talking about housing and residential supports. Can I ask where everyone is from? I know some folks are from DC. We have folks from Maryland, Virginia, anywhere else?
Well, I'm here on behalf of my grandson in New Jersey.
Okay, New Jersey. Okay. Well, so what I will tell you is kind of generic information that is pretty applicable wherever you live, but you know, things vary based on where you live. That's I think one theme that I want you to remember is depending on where you live, the programs available might look very different. So when we talk about housing and residential supports, really what we're talking about are two interconnected things. First is the house and the box that a person lives in. And the second is the supports that are needed to keep that person with autism safe, happy, fulfilled in wherever box they are. Now, you can, housing comes in as many different forms as you or I can go and find a house for ourselves. You can have housing for someone with autism in your family home. They could live with friends on their own in a typical house in a neighborhood. They could live in apartments, condos, wherever you name it. There's also other housing options that are owned by people who provide the same support services that are needed, but in a lot of cases, you might want to separate your house from the actual services. So to begin with, when we talk about housing, not the support services, not the residential services, but housing for individuals with autism, usually the most accessible types of housing for folks with autism are housing that's being developed for low-income individuals. So most adults with autism who don't work can receive SSI, and that provides them with a very, very small benefit, and it's usually too small, $700 or so bucks a month. It's too small to really afford their own house. So there are lots of different housing programs operated by state and local governments that can help provide housing assistance. So that's assistance to buy the place, to buy or rent the place you live. It's not assistance with the support services, the staff, the technology, the other types of supports you need to keep someone with autism safe. So if you haven't already and you have an adult with autism in your family, apply for Supplemental Security Income, or SSI. SSI is not going to give them a lot of income to really support themselves, but in many instances, they will be able to receive priority consideration for housing services that are operated by local and state housing assistance agencies. For example, in Maryland, they have a home buying program for individuals with disabilities. If you are someone with a disability who's on SSI in Maryland, you can go to their Maryland State Housing Agency and get into this home buyer program. And they will work with you to help secure financing to purchase a home that you can afford. That same program is open and available to family members who have someone with a disability living with them. DC has something similar, but I'm not exactly familiar with all the ins and outs of that program. Virginia has a program that is targeted only for people who are low income. So if you care for an adult with autism who is on SSI, they can get assistance from the Virginia State Housing Agency to help them secure housing, either in the form of purchasing it or in the form of securing a housing voucher or rental subsidy. So the first sort of homework you have is in obtaining housing support for your loved one with autism is to identify your local housing agency. In Montgomery County, you'll have a Montgomery County Public Housing Authority. In Fairfax County, it's the same. In other parts of Virginia and Maryland, it might vary. Arlington City has a housing authority. I think Alexandria City also might have a housing authority. But essentially, if you just Google the place you live, housing authority, that should get you to where you need to go. When you get there, you'll need to inquire about housing assistance programs for people with disabilities and low-income individuals. Some of these programs you might have heard of before. Section 8 is one program you might have heard of. That's a rental voucher. That is a voucher that a person who's low income can take and go use to rent a place anywhere, as long as the landlord has signed up to take that voucher. In many cases, Section 8 has a waiting list that is closed, meaning you can't get on it. However, you should contact your local housing authority, inquire about Section 8, and find out if you can get a person with a disability on the waiting list. In a lot of cases, someone who's on SSI will be given priority over someone who's not disabled from the housing authority. So SSI kind of is important in providing a wider gateway into some of these housing assistance programs, more important than just the amount of money that you can receive from SSI. Do you have a question?
Is this applicable for someone who could live independently?
Yes.
Not for someone who would need assistance?
It's applicable for both, because what families have been able to do is families have been able to become a landlord for someone who has a Section 8 voucher. Let me give you an example. I know a woman who has an adult son with autism. She lives in Massachusetts. He got on SSI when he turned 18, even though he was still living with her, which was all fine and dandy. She knew he wasn't going to live with her in her home forever, but she also wasn't ready to go move him out completely yet. So what she wanted to do is she wanted to convert her garage into a garage apartment. She didn't have the money from her own income to do this by herself. So what she did is she investigated Section 8. She found out that she could get her son a Section 8 voucher from her local public housing authority, and that provided him with, I think, something like $700 a month to pay for rent. So it's a subsidy that you use to apply just like a rent check. And so the mom decided she was going to become a Section 8 landlord for her son. She contacted the housing authority. She found out all the rules. Each housing authority might have different rules about what you have to do to be a Section 8 landlord. In her case, she had to install a sprinkler system. She had to make sure there was a fire extinguisher and 2 routes of egress out of the basement, or out of, the apartment that she was converting into her garage. And there were a few other things she had to make sure she followed with the Section 8 rules. One of the rules from her local public housing authority was that a landlord could not be related to the individual using the Section 8 voucher. So she went to the housing authority and she said, because my son is disabled, would you please give me a reasonable accommodation under the ADA? And they said yes. So if you think that you would be able to convert your basement into an apartment, into a freestanding apartment with its own locked entrance, or if you have a garage that you could convert into an apartment, or if you have another sort of accessory dwelling that you could put on your already owned property, consult with your local public housing authority to find out if you could do that using an ADA accommodation to become a landlord to your adult child. And then using that Section 8 voucher, this mom was able to basically finance the mortgage. So she went to the bank and she said, he's got a Section 8 voucher. It will provide X amount of dollars per month. And that's what the bank used to underwrite the mortgage. And that's how she converted her garage into a standalone apartment for her adult son. And everything was hunky-dory. And now, I also knew a family in Fairfax County, Virginia. Exact same situation. The Fairfax Public Housing Agency dug in its heels and said, we don't want to do that. But a lot of people are trying to put pressure on the Fairfax Public Housing Authority to do the right thing. And where we last left off with Fairfax is that folks were contacting sort of legal aid services to help convince Fairfax Public Housing Authority that they did indeed need to make an ADA accommodation to allow families to use Section 8 vouchers in Fairfax County in this way. So I would say, contact your public housing authority, find out about all of their housing assistance programs for low-income individuals and individuals with disabilities, including Section 8 housing choice vouchers and other rental subsidies and home buying programs. There's a variety of different ones that might be available to you. When you get that information, then you can also look for other options in terms of residential supports. So once you secure the place you live, or, at the same time, you need to think about residential supports. And these typically look like staff that come in and help keep an individual with autism safe. Or, help them learn how to, cook food, help them cook food for them, help them keep a house clean, do all of the things that you do right now for your adult child. Most of that assistance, most of those supports are paid for either by Medicaid HCBS waivers or they're paid for by your private pockets. So there's not a lot of in between, unfortunately. With some of the new special needs savings accounts, the ABLE accounts and special needs trusts, you can use that to privately fund some of these services. But for most of us, we just don't have those financial resources. And even if you do have some financial resources, you're still going to need a Medicaid waiver at some point in time, unless you can afford, $60,000 a year in addition to your regular expenses for the rest of your life and the rest of your loved one's life. So, Medicaid waivers. Do you guys know what Medicaid waivers are? No. Okay. So, Medicaid home and community-based service waivers. Home and community-based services, or HCBS. In Maryland, DC, Virginia, and New Jersey, there are Medicaid HCBS waiver programs that provide residential support. Residential support in the form of homes owned and operated by service agencies. A lot of times those are called group homes. Residential support also looks like an agency that sends in staff to either your home or your loved one's home if they're living in an apartment that they're renting. It can look like a variety of different things based on your individual circumstance. But for Medicaid HCBS waivers, there's usually very long waiting lists. In Maryland, they have a kids waiver, an autism waiver that serves children under the age of 18 or 21. I think it's 18. That waiver doesn't have a really long waiting list, but the adult waiver has a much longer waiting list. So if you have a child under the age of 18 in Maryland, get them on the children's autism waiver so that by the time they turn 18, you can just transition them into the adult one. Because there's this rule in Maryland that says if you're on the children's waiver, when you become an adult, you will get the adult waiver. If you're already past that and you have an adult with autism in the state of Maryland, sign them up for the Medicaid HCBS waiver for folks with developmental disabilities. That's operated by DDA. And you'll have a little bit of a wait. It'll be like a couple years. I'm not exactly sure, but it will be based on your severity of needs. And so if you have a health condition and that prevents you or limits you from being able to provide care, if your loved one has multiple chronic illnesses, or if there's a variety of different situations that might increase your loved one's needs, then they might get services sooner than other people. In Maryland, generally, the waiting list moves at a pretty steady pace. Same for DC. In DC, they separate the kids services from the adult services just like they do in Maryland. And when you move from the kids services to the adult services, you go from the Medicaid agency to DDA in DC, and you can really only get those services from DDA in DC when your loved one turns 18. But they still provide HCBS waiver services, and you still have to go through them to really access that support. In Virginia, things are a little bit up in the air at the moment. Prior to this year, Virginia operated multiple different waiver programs serving our community. They had one called the Intellectual Disability Waiver, and they had one called the Developmental Disability Waiver. They're being put together, kind of, and redesigned. As a result, everyone right now is waiting to see where their new place on the waiting list will be. So, if you haven't yet signed up for the waiting list in Virginia, you need to do that today. I would recommend you contact your local community service board, which is the entity that's the sort of the entry point into the system. It kind of is today. It will definitely be the entry point starting August 1. So we're in a transition period. Between now and August 1, there's multiple doors you can still access. But starting August 1, the CSB will be the primary. So if you haven't signed up for the waiver today, contact your CSB just because eventually, you know, it's all over the place. They're the guys you need to go through anyways. So once you're on that waiting list in Virginia, they will call you and they will walk you through a prioritization, kind of like a survey. And they're going to prioritize you on the waiting list based on what you tell them, based on your answers. So I tell everyone I talk to about housing and residential supports. Anytime you talk to your case manager or an eligibility worker or someone from the state who's coming out to assess you for services, you need to make your situation, you need to describe your situation in the extremist terms possible. I don't want you to lie, but on the day they show up, it needs to be, you need to explain the worst day to the worker, because if you don't, then you might be given a priority category that's, you know, planning or doesn't really need it today. And, you know, when you've got thousands of other people who are all trying to get access to the waiver, what's important is that you underscore and you emphasize your needs so that you're placed in order based on your needs and the severity of them. So that's DC, Virginia, and Maryland. In New Jersey, I'm not as familiar with the local systems, but what I can tell you is that they've got kids care separate and they've got the DD waiver in another agency. You need to deal with the DD waiver to get residential supports. And so you'll need to go through their developmental disabilities agency. I think it's called DDD. If you just Google your state name, developmental disability, HCBS, you'll get the information that you need about your waiver. So once you get the waiver, you can actually find a agency to provide you with support staff to come into a residence where your loved one lives. So if they go to the housing authority, they get a rental voucher, they go rent an apartment, or they go rent a room with 3 other roommates who have autism, you can get an agency to come in and take services to them. You can also do that if they live in your own home, in your apartment, in your basement, in the apartment in the back, or you can find an agency that owns a home and operates it. Some people like that model, other people don't. What we found in the autism space is, one, there's not a lot of high quality group homes that know how to serve our people very well. And as a result, when the bed opens up, it's snapped up very quickly because people know that's a high quality provider. So a lot of families that I talk to, they end up they don't go the agency-owned house route. But it's definitely an option for people in the Medicaid HCBS waiver program. If that's, you know, if you find a good waiver, or if you find a good group home that you really like, that has good staff support, they're well trained, they know how to keep your loved one safe, and they know how to integrate your loved one into activities that they really like to do. They have, you know, good control over what they want to do, and if they want to go to somewhere on the weekend, you can find a provider like that, but it will be a lot more difficult to locate just because the good ones are snapped up. So generally speaking, though, in every state you'll have those options available in your waiver programs. Question back here.
I just wanted to know, is there a certain criteria we should be looking for other than what you just said to see if it's a quality group home?
Yes. You want to look at staff turnover. You want to look at their staff training requirements. And you also want to look at their staffing ratio. So how many staff do they have per individual? But then also beyond that, you want to ask them for their latest survey and certification report from the state. So just like child care centers, the state comes in and looks at group home providers, and if they've done something wrong, they'll get a citation. You know, and conversely, if they were providing services and someone got harmed in their care, that will be reported to the state. That information, however, you know, you shouldn't rely only on that. You should talk to other people who've used them. You should also ask them about how they make their services person-centered. So, if you live in a group home, if your kid wakes up and decides he wants to have oatmeal, but everybody else is having Cheerios, can he have oatmeal? If the answer is no, then I would be a little bit wary of that place, because what you want is a provider who knows how to let the people in their home live a fulfilling life based on their own terms. And so if it's all scheduled and regimented based on the provider, not, our folks, like my youngest son cannot deviate from routine. So he needs to follow a routine. Every day, I know he's going to have, Apple Jacks for breakfast at, 8:30, and then in a half hour, he's going to have 1 tube of Go-Gurt. That's fine for him. But what you want is that to be dictated by your child. You don't want the provider to say, today's routine is going to be X, Y, and Z, because then what happens is you kind of become at the mercy of that provider. So you really want someone who's responsive and knows how to let everybody have their own services individualized while still keeping them safe and providing them all of the necessary supports they need. Yes?
I have a question about group homes. Are the staff supposed to be there 24/7 for supports, or is that
It depends.
in and out? Or?
It should be based on the needs of the people living there. So if you don't need 24-hour supervision, there should not be 15 minutes, cool. There should not be 24-hour staff on site. If, however, you have someone who needs 24-hour staff supervision, then that's what you want to see. But the most important thing is you have a provider who can tell you how they individualize services, how they determine how much staff is needed versus how much is not. And then also I think what's important is to look for providers who utilize technology in smart ways. I went down to a apartment complex in Richmond that was being developed, in a portion, like 20% of the apartments were set aside for people with autism or disabilities. And those were all wired to have technology in it so that if the person wanted, they could hook up remote monitoring technology. One of the residents had a seizure disorder, and so they hooked up motion sensors in the bathroom that were monitored by an off-site company so that if they went into the bathroom and fell or had a seizure, then the remote monitoring company would see, they'd walk into the motion detector would tell the remote company they've entered the bathroom, and then after 25 minutes of motionless, they would have an alert, and they would call in, kind of like in an intercom on the wall of the bathroom, and say, are you all right? You've been motionless for 25 minutes. Do you need some help? And that was sort of the technology that the consumer who was living there really knew would work for him, because he didn't want, security cameras watching him in the bathroom, but he had a history of having seizures, and in the bathroom in particular, it was very dangerous for him. So he built this, he worked with the apartment complex to sort of hook up the right kind of technology he needed. And so in some cases, you can have providers where they'll utilize technology very smartly and wisely in order to avoid having to have staff on site, because it's your own home. Some people don't need that level of supervision, and when it's there, it can be sometimes intrusive. Conversely, if you've got a provider who has a bunch of security cameras in there, they might have a false sense of security and say, well, we don't need to send staff because we've got security cameras in there. And so you have to look at those things as well. Other questions? Yes.
Is a Medicaid waiver and I know that a Section 8 voucher can be portable anywhere in the country.
Yes.
If you have a kid who has a disability, Asperger's,
Mm-hmm.
and there's a training program out of state, could that Medicaid waiver go to another state?
Unfortunately, no. So the question is Medicaid portable? Are Medicaid waivers portable from state to state? No. That's the unfortunate reality. In Florida, if you move to Florida and you're militarily connected, then you can jump the waiting list. So most states have long waiting lists for the waiver. And I'm only aware of Florida that allows people to jump that waiting list if they move to Florida and they're connected to the military.
Meaning active duty.
Active duty or I think reserve. Yes.
What particular waiver is this? Because I just moved from Florida and my friend with 3 boys on the spectrum is military family.
It's the iBudget waiver, and yeah, iBudget. It's that is the waiver for developmental disability. So if she's got, did you say her 3 boys all had autism?
Yes.
Yes. Okay, so she should contact the agency for people with disabilities.
Okay.
And anyone,
Her husband is retired military though.
I don't know about that.
Okay.
If he's reserve, then the answer is yes. But also it depends on their particular circumstance. If he was moved there while he was still military, then she should contact them and say, we moved here as a result of a military change, and we want one of your military waiver slots.
Okay.
You know, I can't promise anything, but in general though, in any state, Google state name, developmental disability, HCBS waiver, and you should be able to get to the agency that operates it for your state. Yes, you had a question here.
Yes, is it reasonable, or does it happen that, say you have a young adult in a group home, and would the caregivers in the home drive them to programs that they're participating in? Is that typical?
Is it typical? Yes, but it varies. So if an agency owns a home, then the agency typically owns a van that they transport their folks around in. But that's not always a hard and fast rule. You could have a provider agency that owns a home, but then they contract with another agency to come provide the transportation services. Finally, some very good providers, if you live in a urban area, will make sure that they're located near transit, because you know, one of the more efficient way, it's cheaper for providers to utilize existing transit options. A lot of times they don't get enough money to pay for a bus and staff to take everybody where they need to go. So in particular, if you live in an area like the Mid-Atlantic here, the DMV, we are connected by transit. And if you're looking for a residential option for your loved one, I would definitely look for something that's transit oriented. Because that will help not only connect them to the broader community just in general, but like if they're looking for day activities and employment, that will enable them to get there, you know, in a little bit less sort of effort, because you're already connected to different places. So does that answer your question? I can tell you that Medicaid pays for non-emergency medical transportation. So whether or not you're on a waiver, if you have Medicaid, then Medicaid will pay for you to get to and from medical appointments that are not emergency. So in other words, the ambulance will take you to the hospital, and the ambulance will be paid for by Medicaid if it's an emergency. But also, if you need to go to the doctor or to the therapists and it's not an emergency, Medicaid can pay for that transportation as well. That's beyond what's in the Medicaid waiver. Medicaid waiver can pay for transportation to a community activity, to a job, to a family house, you know, a family member to go visit. It can pay for a lot of different things. At the same time, if you live in this area, you can get paratransit from Metro, and you know, in the suburbs, the different, like Dash, they operate a paratransit program, which is essentially like, you've seen the Metro Access buses around DC, that's paratransit. They'll come and pick you up and take you to a location. It's not the best option, but it's available here and elsewhere. It'll be available in New Jersey. Unless you live in a very rural part of America, you will have access to paratransit services.
Now, are there homes that actually incorporate not just the day-to-day living, but enrichment programs such as training programs?
Right, day activities.
Yeah.
So there are some programs like that. However, they've fallen out of favor because that was a model that was developed, you know, in the 1960s. And what we saw happen is, in many cases, you'll have a provider that is kind of a one-stop shop. So it's a very large campus. You've got a training activity, a school, and everybody lives here. You live, work, and play all in this one location. Though they exist, they're getting fewer in number for a variety of reasons. When you don't go outside and connect with other people in your community, and the only people you deal with are on your provider campus, then the rates of abuse and neglect and exploitation tend to go up. Not because there's bad people in the world, but what happens is you have less additional connections, you have fewer unpaid connections who are disinterested and who would be able to keep an eye out for you. If you're a paid staff member, you won't necessarily, well, you're just better protected the more non-paid people you can have in your life.
I wasn't visualizing that all the activities happened in the residence, but rather that the residents would readily connect you to opportunities in the community, whether training, educational, employment.
So that is a best practice, I will say. Some providers do that well. Not every provider does. There are some providers who, they have good intentions. They operate a workshop and they have a group home. They'll put everybody in the group home in their van and they'll take them to their workshop. Then you have other providers who actually do that. They'll work with their residents and they'll identify what are the things you like to do on a Monday night. You like to go play bowling? Fine. We're going to go to the bowling league and get you set up and do that. And you'll do your own individual thing and your roommates will do whatever they like to do on Monday nights. Those are really good providers. And when you're looking for providers, I would ask them about, how do you foster connections to community, work, other important aspects of community adult life for you, your family, and your loved one. I think that's a key best practice to sort of identify with residential service providers. Yes?
What resource would you go to find these types of places?
Oh, well, unfortunately, Google, word of mouth. There are trade associations. So your waiver agency, when you get your slot, will give you a list of all of the waiver providers in your geographic area. And it will be a long laundry list, and they won't tell you anything about them. And it might even be in non-alphabetical order so that the 18 agencies that are AAA, blah, 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 are not at the top. Because agencies have done that. The answer is there's no good resource out there. The best resource is word of mouth and talking to other families, talking to folks who've used them. But also, you can go back to the state agency and you can look at their survey reports and identify, do they have any violations? That's kind of like your basic level of, got to get past that in order to use their services. Although at the same time these residential providers exist, what a lot of folks have started doing is they've started self-directing their own services. And self-direction is essentially where you cut out the middleman. You don't use an agency to provide services. You go hire the people you want to provide the caregiving support. You go and you hire, it's basically a domestic care worker. It's like hiring a nanny or someone else to provide in-home support for you. And you identify them and then you use your waiver to pay them. And you can, usually what happens in DC and Virginia and Maryland is they make you use an agency to take the money from the state and cut a check for your worker. But you're the one who can actually find the worker and have them come into your home. And that way you don't have to worry about finding an agency that does it right. All you have to do is find the right domestic care worker you want to hire, and then you can train them the way you want them. And you can work with them to, develop a schedule of community outings and train them on how to transport them, train them on how to, keep your loved one safe while riding public transit, for example. And that's actually growing in far more popularity than other flavors of residential supports. Yes?
So my daughter gets Medicaid, so are you saying that Medicaid will pay for her transportation to her therapist?
Mm-hmm.
How would I go about doing that?
Contact your Medicaid case manager. Are you in Virginia, Maryland, or?
No.
So contact, is she on the kids waiver?
No, she's not.
Okay, she's just on regular Medicaid. Contact the Medicaid agency. You might have a Medicaid health plan or a Medicaid case manager who works for the health plan. Contact that person and tell them you need to find out about non-emergency medical transportation. That's what it's called. Other questions? Yes.
My son is at SSI since about a year or so. And one of the things that we use it for housing is he lives in our home, and we arbitrarily assign like $400 for him to pay the rent. The question I have is that $400 a month that he pays me, should I count it as my income when I file my tax return?
So I would consult a tax attorney, but I think the answer is yes. But consult a tax attorney, definitely.
It wasn't real clear to me whether that was.
Yeah, it kind of depends on a lot of different variables and whether or not, for the purpose of SSI, you told the Social Security Administration that you're providing for his room and board, and if that's what you told them, then you have, different tax options available to you. But bottom line is consult a tax attorney. Other questions? What are some of the biggest obstacles you all have found in accessing housing and residential supports?
That there is an obstacle in accessing housing.
Yes,
It is an obstacle.
yes, yes. Back here in the pink.
So, well, I think there's just the options just aren't really available, or at least in our area. But so with like the DDA waiver, so how do you even connect up the housing? I guess like which comes first, to actually find a place that you're interested in and that you want to, and then go back and put in a service and change and wait.
It's a chicken and the egg question.
It's like,
The very first thing is you have to get the waiver.
right. which we
So-
have.
So what I would start with, though, is a person-centered plan that focuses on the goals, the life goals that your loved one has. I'm assuming it's your child, that your child has. So, what would be a fulfilling day, week, month, year for them? What would that look like? Start from that and then work your way out. And it's kind of like you kind of have to think about it in terms of hierarchy of needs, right? You know that they need to they need shelter, but what that shelter looks like should be based on what a fulfilling life looks like for your child. And so,
To practically do that, to practically get those services in place, I guess that's where we struggle with, because it's like, well, he lives in my home and he has a roof over his head, so until I'm dead and he has nothing, then it's like, oh my gosh, he needs a place to live, let's put some supports in place. It's just so reactive. So proactively, how do you do that? Yeah.
How do you go from, your current status quo to planning for a more independent life for your child? What I would start is, do a good life plan using sort of person-centered practices, looking at what's going to be a meaningful life for your child when you're gone, with or without you. Start with that and then go and involve your waiver case manager and start building out a plan that is sort of your aspirational plan, and then look at it in terms of how do you have to go from here to there. And what you'll find is that, if you want to have if a meaningful life for him without you would look like him living with some roommates in an apartment that they rent together, then how do you get that? And it's a matter of identifying the service planning changes from the case manager. But I think what you're dealing with is, in a lot of cases, these programs are very reactive to, like, well, you can take care of them right now. Why can't you do that forever? So that's why I think if you start with the goals, you can say, it's his goal, or it's our goal for him, that he would have his own place to live by age X. And then use that and pin your plan on that. So, focus on that, as well as looking at things like, what's he doing during the day? Is he working, or is he at a day activity? Does he want to work?
It's fine.
It's time to wrap up.
Okay, this session is over. Please gather your belongings. Thank you for attending the town hall, and remember to fill out an online survey, which will be emailed to you.
Thank you. So before I go, though, I would just say, it's important to think about services in terms of that aspirational goal. And really, it comes back to working one-on-one with your case manager.